Are you a patient desperate to find a specialist physician? Did you get a referral from your primary care physician and you cannot find a specialist in your network for the next 4 to 6 months? Did you feel rushed in your last 7 to 12 minutes appointment? Are you frustrated by the lack of transparency regarding the costs of your care? And despite paying more and more for your health care insurance, each year you receive less and less in your medical care. You are not alone. There are millions of patients that feel the same. Let's talk about the traditional medical system that we know today. When people think of healthcare, they think of today's traditional healthcare system. This comes to no surprise to none of us. It is what most people have most experience with, and this is one of the things that may have grown up with. However, not everything that we use today is perfect, including our today's healthcare system. Decrease access to care. Medical care and healthcare insurance are not equal. Sadly, carrying a health insurance card does not guarantee the medical care that you need. Most patients that come into my practice carry health insurance, but when they need to use it, they do not have access, or that access, it comes months too late. In many specialties, including rheumatology, waiting times are for about 4 to 6 months. This is detrimental, as waiting for months on end will only worsen your condition and lead to sitting in more pain. Decrease time with physicians. A significant problem with today's healthcare system is that waiting times for appointments is paired with relatively short visits. When you finally are seen, you have approximately 7 to 12 minutes with the physician. Is that enough time for you as the patient to address your concerns? No. Is that enough time for any physicians to examine, diagnose, and offer you a treatment solution for your problem? No. Physicians need time to understand and get to know their patients. Physicians need time to construct a plan and provide excellent medical care. Time with patients is of essence. This is equally frustrating for patients and physicians and often decreases the quality of medical care that you will receive. So why is this happening? The answer is quite simple: profits. Physicians are not valued based on how well they provide you care in the big medical systems. Our value comes from billing, CPT codes, and productivity models. The more patients we see, the better revenue for the system. This is why physicians are often swamped with patients, having to see as many as 30 in one day, yet only spending 10 minutes with each patient. Astronomical costs. The costs of health insurance increases every year, but what you receive in medical care decreases every year. We all know that the costs of healthcare in the United States are astronomical. Healthcare insurance is supposed to protect patients from medical debt. It is supposed to be your safety net, but it does not do its job. I know many patients that carry insurance, but they are afraid to use it. Despite paying for copayments for your medical appointments, it is common to receive surprise bills many months after you received care. The costs of your care are not disclosed, and you, the patient, cannot make an informed decision. Why are the costs in healthcare so high? It is simple. There are too many layers, too many middlemen between the patients and physicians, which will result in higher and higher costs. Many patients in the United States with health insurance file for bankruptcy because of medical debt. Ultimately, this dramatically affects the price of your health. Most times, patients pay far more than what they think is a monthly insurance rate. Hello everyone, I'm Dr. Diana Gurnita, a board-certified rheumatologist practicing direct specialty care. In 2020, I transitioned into private practice and founded one of the first direct specialty care practices in rheumatology in the United States. My company opened the door to many patients like you that were desperate to find a specialist when they needed the most. People like you that felt disappointed by short visit appointments and moved from specialist to specialist in an effort to find out what is going on with their health come to see me in my practice. I hear this story every day. I am here to tell you that there is an alternative way to receive the proper medical care, actually excellent medical care. Direct specialty care offers you time, value, expertise, access to your doctor, personalized care, and excellent medical care at affordable and transparent pricing. You, the patient, have the power to decide what is best for you and where your money goes. The future of healthcare is in your hands.